everyone, my name is Saibisi Kabilin, a student nurse from the University of Mindanao. Today, I am going to perform a step-by-step procedure of Leopold's maneuver. Leopold's maneuver is a standard palpation of the abdomen for assessing the fetal position, presentation, and the degree of descent. So, the purpose of Leopold's maneuver is to determine the number of fetus. Second is to identify the presentation, position, degree of descent, and attitude of the fetus. And the last one is to identify the point of maximum intensity of fetal heart tone in relation to the woman's abdomen. So the equipments needed are the first is the pillow, second is the tape measure to measure the fundic height, and the last one is the stethoscope to locate the fetal heartbeat. So the first procedure is to check the client's chart. Read the doctor's order for the said procedure and check the client's condition and restriction to ensure that you're administering the procedure to the right client. So the second procedure is to do client's assessment to obtain obstetrical history including parity, gravitas score, LMP, ADC, and AOG, also fundic height. To gather data would make computation accurate. Also, to take the vital signs to the client. To baseline data prior to doing the procedure for comparison purposes. Excuse me, ma'am. May I ask you some question po? When was your last period, ma'am? Okay po. How many times did you get pregnant po? Okay. Is this your second child po? Thank you, ma'am. Next is to explain the procedure to the client. This to elicit cooperation of the client. It reduces apprehension and encourages cooperation. Hi ma'am, good morning. How are you today? I am Saidi Kabilin, a student nurse from the University of Mindanao. May I know your name, ma'am? Can I see your ID band po? Okay. Today, I will be performing a Leopold's maneuver. In this procedure, ma'am, I will touch your abdomen to assess your fetus position and presentation po. Thank you. The next procedure is to instruct the client to empty her bladder before performing the procedure to avoid discomfort to the client and provide relaxation during the procedure. Excuse me, ma'am, can you empty your bladder first before we proceed to the procedure? Okay. Do you want me to assess you or not? Okay, thank you, ma'am. The next procedure is to do the hand washing prior the procedure. To do hand washing deters the spread of pathogens. The next procedure is to provide for client's privacy to ensure cooperation of the client during the procedure. Next is to place woman in dorsal recumbent position or supine with knees flexed to relax abdominal muscles. Drape the client using the top sheet or blanket exposing only the abdomen and place a pillow under her head to have easy access during the maneuver, to make client more comfortable and gain cooperation. Next procedure is to make sure that the hands are warm before coming in contact with the client's abdomen. Rub the hands together vigorously to prevent uterine contraction and use the palm of the hand instead of the fingers to prevent starting to the clients and to produce warmth.
The first maneuver is what we call fundal grip. Using both hands and facing the client, feel for the fetal part lying in the fundus. Determine the shape, size, mobility, and consistency of what is being palpated. The findings is head is more firm, hard, and round that moves independently of the body. Breech is less well-defined and moves only in conjunction with the body. The purpose of this is to avoid overreaching of the client's abdomen and able to palpate the fundus and feel the parts lying. So the second maneuver is what we call umbilical grip. One hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly in a circular motion from top to the lower segment of the uterus to feel for the fetal back and small fetal parts. Use gentle but deep pressure. Repeat this step on the opposite side using the opposite hand. Findings: fetal back is smooth, hard, and resistant surface. Knees and elbows of fetus filled with a number of angular nodulation. To use both hands in palpating aids in correct findings during the second maneuver. Third maneuver is what we call Pollick's grip. Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and make gentle movements from side to side. Findings: the presentation part is not engaged if it is not movable. It is not yet engaged if it is still movable. The usage of thumb and finger would help in the determination of the presentation part to either engage or not engage yet. And the last maneuver is what we call pelvic grip. Facing foot part of the pregnant woman, palpate fetal head pressing downward about 2 inches above the inguinal ligament. Use both hands. Findings: good attitude if brow corresponding to the side that contain the elbows and knees, and it is poor attitude if examining fingers will meet an obstruction on the same side as fetal back. Hyperextended head. Also palpates infant anteroposterior position if brow is very easily palpated. Fetus is at posterior position. To avoid overreaching of the woman's abdomen.
The next procedure is to place client to its proper and comfortable position to make client relax after the procedure. Next is do hand washing to reduces transmission of microorganisms. The last procedure is to document the procedure and assessment during the care. A careful record is important for documentation after client care. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. And that's how I performed Leopold's maneuver. I hope you learned something. Thank you for watching.